Okay, this video is why do people get sick? A quick overview of why people get sick. Because when you understand this, then it makes it easier to avoid it. Okay, most patients have the same disease in the Western world. Almost all of them. They have hypertension, and then they're pre-diabetic or diabetic. And Nathan Pritikin had the joke. He said, if you tested American patients for diabetes after dinner, they would all be diabetic. And the joke of it is that after they typically eat a high-fat dinner, and so they would fail their oral glucose tolerance test. All right, so what I'm getting at is these are preventable diseases. These are dietary diseases, hypertension and diabetes. And then the hypertension and diabetes push into causing atherosclerosis. And then the atherosclerosis starts plugging up arteries everywhere. Plugs up arteries in the brain, they get cognitive decline. Plugs up artery in the Johnson, they get impotence. Plugs up arteries in the eyes, they get all the eye diseases are vascular diseases. Sea dog, cataracts, hypertension, age-related macular degeneration, hypertensive retinopathy, and glaucoma. They're all vascular primarily. There's also, milk, dairy related to cataracts, for example, hypertension, especially glaucoma, of course, and hypertension, of course. All right, anyways, they get back pain because it causes atherosclerosis in the spine, so they get back pain, and they get all those degenerative spine diseases are really compensation for degenerative disc disease. Okay, hearing loss, blindness, and why is it? Why does a diet cause this? Because the high dietary fat sticks the red blood cells together. You're pumping thick blood. You get hypertension. Okay. The high dietary fat causes insulin resistance. It's the main cause of both hypertension and of diabetes. That's why Nathan Pritikin said fat is bad. That's why Dr. McDougall said fat is the biggest toxin in the Western diet. That's why I tell you there is no such thing as good fats in terms of dietary fat. The small amount of essential omega-3s and omega-6s, you get that fine just by eating low-fat plant foods. Okay. And then you can make it worse if you're throwing caffeine in there, which mimics acute stress. Psychological stress also causes hyperlipidemia. It also increases blood pressure. It also is an excitotoxin. So it is harmful. Excess psychological stress is bad. You need a little stress just to motivate you to get out of bed, to perform, do whatever you got to do. But excessive psychological stress on a prolonged chronic basis is harmful to health. Okay, and then excessive dietary protein is especially bad, and especially animal protein for causing osteoporosis, potentially muscle wasting, but especially osteoporosis and also predisposing people to kidney failure, okay? The animal protein especially. All right, then the things that you're missing the plant food stuff. You're missing potassium, magnesium, plant nitrates. Those are all vasodilators. The plant antioxidants protect you from oxidative stress, help protect your mitochondria, okay? Then you're missing the dietary fiber. So the lack of dietary fiber means a pressure problem. Normally dietary fiber adds water to the stool, so your stool is kind of liquefied, relatively speaking, and it's more bulky, all right? And it stretches your rectum, causing a reflex contraction when you're ready for defecation to defecate, and it's almost effortless. If you don't eat enough fiber, your stool's dried out, you strain it at defecation, it's a Valsalva maneuver. The back pressure causes all kinds of pressure-related diseases. In the veins, varicose veins, in the rectum, hemorrhoids, in the scrotum, varicocele can cause infertility. Okay, then it causes increased inguinal hernias, increased periumbilical hernias, stomach herniates in the chest, hiatal hernia associated with gastroesophageal reflux, associated with heartburn discomfort, increased risk of esophageal cancer, gastroesophageal cancer. Okay, so that's all the pressure stuff. Also diverticulitis, diverticulosis, dried out stool on the right side of the colon, appendicitis. Okay, you almost never see those things in a population that needs a lot of fiber. Then the lack of fiber also predisposes to leaky gut. Okay, there's other things predispose to leaky gut, like the chemicals in the tap water and a lot of medications, NSAIDs, aspirin, etc., emulsifiers. Okay, alcohol does it as well. Leaky gut then allows bacterial toxins in your blood that predisposes to clotting, especially a type of clotting called amyloid clotting. Also inflammation, neuroinflammation, because when you got leaky gut, you got leaky blood-brain barrier. It drives your immune system crazy, okay? Your immune system starts to hyperreact, causing all kinds of problems, increase autoimmune disease, all right? So you don't want leaky gut. Eat your fiber. Avoid the toxic stuff, okay? Then all the things that start with S, which means you need to, get along with people, so you maintain a social support system of some extent. Get your sunshine for not just vitamin D, but for your sulfates, for your nitric oxide precursors, for your overall health. All right, have a sense of purpose in your life. People who have a sense of purpose are more resilient. If you think that life is meaningless and you're just here to have fun, then you're going to have a hard time withstanding the inevitable disappointments and sadness and setbacks and frustrations. And, life's got difficult problems in it, and you got to have something that makes it worth worthwhile that you can deal with all that. Spiritual, people are religious, they're much healthier. Harold Koning's written all about that extensively. Sedentary versus exercise. You exercise, you build up resilience, you get your sleep, that's when you heal. That's when you get your gains from your exercise. Trauma, avoid head trauma. A lot of sports, there's a lot of head trauma. You want to avoid that as best you can. Toxins, there's a lot of toxins. The main stuff is the dietary stuff. That's the most important stuff. But these toxins matter. Okay, heavy metals. There's toxins in your drinking water if you just drink tap water. There's aluminum. There's F-, fluoride. Okay, there's tons of other stuff that are removed by carbon filters that they don't filter out. All those estrogenic chemicals. And a lot of these things cause leaky gut. Aluminum causes leaky gut. Chloride causes leaky gut. Fluoride causes leaky gut. Alcohol causes leaky gut. Emulsifiers in processed food predispose to leaky gut. Carrageenan in processed food predisposes to leaky gut. There's a whole bunch of them. A lot of prescription drugs predispose to leaky gut, plus prescription drugs in general, a lot of them have side effects. A lot of people die. It's like, I think, the third most common cause of death. They die from side effects of prescription drugs. Okay, substance abuse drugs have tons of side effects. Alcohol, tobacco, marijuana. Marijuana increases your risk of dementia, increases your risk of schizophrenia, increases your risk of just loss of motivation and amotivational syndrome, leading a purposeless, sort of, mediocre or lousy life compared to what you could do. Mitochondrial inhibitors, excitotoxins, circuit inhibitors, they're all related to disrupting calcium metabolism in the brain, So anyways, that's why people get sick. The most important thing is getting the diet right and all the other stuff. The other stuff, is really important, the social stuff, but most people are pretty good at that. By the time think about going to your high school reunion, how nice everybody was in comparison with what a jerk some of them were in junior high and high school. They learn the social stuff. But the thing that most people never learn is a good diet. So anyways, I'm just showing you, this is what makes people sick. And you could avoid almost all this stuff. You could fix your diet pretty easily. You could now plan into your life, getting your sleep, getting your sunshine, maintaining your social support, your purpose, your religion. All that's doable, and avoiding these toxins. So anyways, that's how it works. So it's doable. It's not just a mystery. It's not inevitable as you age. You have to be fat, sick, and stupid.